We know that blood cancer is not just a disease. There are actually several different types and subtypes of this condition. Unlike other cancers, in which are kind of limited in terms of how diverse the condition is, cancer is actually really, really quite diverse. There are five main groups of blood cancer. We have the leukemias, the lymphomas, myeloma, the myeloproliferative neoplasm, and the myelodysplastic syndrome. Many of these conditions have several different types and subtypes. So it does pose a very unique challenge in trying to grapple with the various challenges with it. Some blood cancers are very much highly treatable, and the survival rates of those cancers are actually way much more increased or larger than some other conditions. While some, even with the advancement in treatment modalities and also, high supportive care, some of these conditions still remain quite uh, adequate and proper management of this condition. Over the years, particularly since the early 1960s, the survival rates for many blood cancers have not only doubled, some have actually even tripled. Many people in the last 60 years have actually been surviving blood cancers at a much higher rate. Some leukemias actually have as high as 95% survivorship rates. Going by the current treatment modalities that are actually available for the condition. And so, if one looks at these increasing survival rates, it now begs the question that why is the survival rate still very much low in low and middle income countries, particularly in sub-Saharan Africa, which Nigeria is a part of. And that's why we are having to look at areas in which what are the things that could be responsible for this and what can we do, to actually change or reverse this trend. Would get to speak more about this as we move on with the presentation. Now, this particular slide is, one of my favorite slides in terms of having to give a stark comparison of the survival rates of this condition. Here we see that according to only 1 out of every 20 Nigerians suffering from leukemia do actually survive. And this is actually really quite a scary statistic. And knowing that every 20 Nigerians that actually comes down with this condition, only one person or an individual can actually survive this condition. In stark contraction to, on the right side in the slide here, looking at the survival rate of just specifically acute myeloid leukemia. It said that 1 out of every 4 AML patients do not survive 5 years of the diagnosis in the US, meaning that 3 out of every 4 do survive. That's about 75% survival rates, compared to the 94% of the mortality rates in terms of Nigerians suffering from this condition. From the previous slide, we mentioned that over the last 60 years, survival rates globally have actually doubled, tripled, or even quadrupled. But we are not seeing that in our part. And that's why, it's quite disturbing that despite the advancement in treatment modalities and high supportive care, our people are still not having any change in the survivorship of this dreaded condition. So at the White Cell Foundation, that's what brought us not only in even starting the foundation in the first instance, because the two obvious question or pertinent question, you know, continues to linger in our minds that why are people not surviving blood cancer compared to other parts of the world? So what are the challenges? Why are people not surviving blood cancer? The other pertinent question is what can we do when we actually get to answer the first question, having known why our people are not surviving blood cancer? The next question will now be what can we do for our people to survive blood cancer? And that is why this summit is being organized and would be organized annually for us to continue to make sustainable improvements in terms of increasing the survival rates of blood cancer in Nigeria. So this year we have actually picked two topical areas for us to discuss. One is increasing the diagnostic capacity of blood cancer in Nigeria, and the other is actually improving the access to targeted therapy in Nigeria. Annually, we're going to keep discussing all the specific challenges or selected challenges. We cannot address all of it at one full scope, but on an annual basis, we will continue to strive to see how we can actually address these challenges. First of all, identify them and then provide solutions to tackle them. Now, there are several challenges journey. The road to survival for a blood cancer patient, particularly in Nigeria, is quite a tortuous one. The patient journey, right from the stage when the diagnosis of the blood cancer is made, to initiation of treatment, and then the post-treatment, care is one in which, at every stage of it, there are peculiar and specific challenges that need to be addressed. As I did mention at the start of this presentation, just a broad overview of the various challenges blood cancer patients face in Nigeria and some of the possible solutions to actually get to address this. And as I mentioned, in subsequent editions annually of the Blood Cancer Summit Nigeria, we shall be addressing them in detail. And today, comes out the opportunity to actually start off by trying to address two key areas that can go a long way in improving the survivorship of blood cancer in Nigeria. So in the next couple of slides, I will highlight a few challenges and some solutions that we could actually institute to actually help to actually change this trend and then for our people to survive this dreaded condition. Because the pre-diagnostic challenges faced in this part of the world, one is the low level of awareness. A lot of people are still not aware of this condition. And the level of awareness is not just only among the general population or the eventual patient that will be diagnosed with this condition. We also know that there's actually also a low level of awareness even among healthcare professionals. And that's why on this summit, part of the stakeholders, not just only the patients, the survivors, or their caregivers, but also healthcare professionals. We know in this part of the world, particularly in Nigeria, healthcare system is not that well developed. So we know that several times, a lot of before even getting to the right quarters for them to get done to identify the condition itself before proceeding to treatment. Of course, one major limiting factor, major constraint is health-seeking behavior of our people. Not until most people actually get very ill do they even find a way to actually go to the hospital. This is one thing in which we need to address. But of course, many a time, not that patients don't want to seek adequate health intervention. But of course, they know the costs of healthcare is still very much out of reach of the average Nigerian. There is an economic downturn, and people of low socioeconomic status are not able to access the treatment they need. You know, healthcare shouldn't just be a luxury. It's actually it's meant to be the right of every citizen of the world to have access to the best of care. But we know with the low with the poor economy that we currently have, from the dwindling resources of the country, the rise in standard of living in terms of the cost of even staple foods, and all of this stemming from the low economic downturn that the country generally is facing, particularly with the drop in the oil prices and the reduction in the revenue generation government, and also the rising level of inflation. So all of this pose a severe challenge to not only at the pre-diagnosis stage, but we say that the issue of cost implication actually cut across virtually every point in the patient journey to survival. Possible solutions to this with awareness campaign, particularly today, the 28th of May being the World Blood Cancer Awareness Day. It's a good platform or forum to be able to bring the awareness to not only the general population, but also to healthcare providers and also patients, their caregivers, and survivors of this condition. But taking the campaign to the community is also very, very vital to be able to make sure that we actually take the message to the people and make them to be aware that there are conditions and blood cancers, and that if detected early, the chances of survival are actually quite high. Of course, we also have to keep training and retraining healthcare professionals, because many a time the first healthcare professional that a blood cancer patient will present to are actually the general practitioners. And many a time you actually see that a number of times, of course, like in the environment that we have now, particularly in our healthcare practice, a lot of hospitals and healthcare practitioners, the common diagnosis of typhoid and malaria still, actually prevails. And many times we see that patients keep being treated for typhoid and malaria without doing the adequate or the proper investigative tests that are actually needed to actually diagnose the condition. Moving on to the diagnostic challenges. Of course, one very obvious challenge is the non-availability of advanced laboratory and imaging tests locally. Molecular tests, flow cytometry, or some other forms of immunophenotypic tests are actually quite not only available, but even when available, are not locally accessible. Cost implication for this test is also a major challenge that actually makes and it's even difficult to actually even get to have the diagnosis, early diagnosis, which in turn affects the initiation of treatment and of course ultimately affect the survival. Of course, today Dr. Olaemi Daudu will be discussing with us the topic increasing the diagnostic capacity for blood cancer in Nigeria. We look forward to that presentation shortly. Of course, we have to increase the local diagnostic capacity. As I said, we're going to discuss that. And the recurring issue of cost and ability to be able to actually pay for diagnostic tests is still a major issue. So it's known by everyone that having adequate health insurance is the only way forward to this, because not only can one not sustain paying out of pocket for the diagnosis test and also the treatment, it is very highly unsustainable that even those from the middle class or even the high income class, by the time they actually go through the diagnostic process and also the treatment modalities for blood cancer, many would have actually spent virtually all their life savings in trying to survive this condition. But another way to do this is to actually get also have access program, which the foundation also tries to support indigent patients with their diagnosis tests and also their treatment. The treatment challenge is actually quite varied because we said quite a few here. Of course, the recurring challenge of um, cost issues still pervades, particularly when it comes to the advanced treatment or the treatment that have been shown to actually not only very effective and efficacious, but also have a high chance of a curative intent for such patients. But many a time we actually also see that um, even prior to starting treatment, there are challenges in having adequate supportive care. We know that before starting treatment, there may be need for transfusion of blood products, particularly platelets concentrates, which are actually, quite, scarce to get, even where even available, particularly the FRS type, is actually even out of reach for most Nigerians, based on the cost implication of this. Many blood cancer patients succumb to infection before the treatment even commences. So having adequate supportive care, has actually been a major challenge to that affects survivorship of blood cancer. Then, it's also quite glaring that it's not an ability of the advanced treatment modalities, so immunotherapy, targeted therapy, and also stem cell transplantation is grossly, inadequate or even non-available in this part of the world. And these are actually some of the factors that are actually responsible for the reduced survival rates of blood cancer in Nigeria. So we have to improve the availability and accessibility to adequate treatment. Today, at this very maiden edition of the blood cancer study, we will be having a discussion by our panelists on how to improve the access to targeted therapy in Nigeria. Again, one of the solutions would be to actually get to have health insurance to be able to take care of cancer treatment in Nigeria. Would you know that actually efforts in that line actually get cancer treatment to be under the National Health Insurance Scheme? But this has still not taken full effect, and many Nigerians still pay essentially or largely out of pocket to have cancer treatment adequately done. Lastly, in the post-treatment phase, there are specific challenges too. But of course, we even need to get patients to actually even survive past the treatment to get to the stage in which we actually also now even have to grapple with challenges with their quality of life. Some coming down with some other health issues as a result of the treatment they've had, even having secondary malignancies. But as I mentioned earlier, many time most people, even those of high income or even high socioeconomic status, by the time they actually go through the journey through survival of blood cancer, they actually come out quite financially exhausted you know. And so to even get to even sustain the remission in which they would have achieved or even the cure, and not to even talk of if there is now a relapse or a reoccurrence of the cancer, many blood cancer patients cannot withstand or cannot undergo a second treatment phase for the blood cancer should in the unfortunate event that it does recur or it does relapse. And so some of the solutions that can actually help, in addressing this challenge will actually be to actually have support groups or programs that can help blood cancer patients continue to live a very productive life post surviving blood cancer. And of course, the recurring solution here that I've highlighted is we cannot overemphasize that the need to actually have adequate health insurance because Treatment of blood cancer is actually quite expensive, and so a lot of funds are usually required to be able to achieve the adequate survival. So I'm going to end my presentation with this very last slide. Further highlighting that we are not just in for the talk, we also want to walk the talk. At every edition of the Blood Cancer Summit Nigeria, SURVIVO, shall be coming up with an action plan in which we want to not only identify what needs to be done, we also need to know who is going to do it, when is it going to be done, how is it going to be done, and how are we going to ensure that it's actually adequately implemented and that we can actually see parameters or metrics that can show that we are actually making improvements. We want to see improvements on an annual basis. Of course, we need to strategize to be able to have this achieved. We need to also implement the action plan. Of course, we need to also make sure that we actually collaborate with others. Of course, we have to set achievable targets and also, provide a schedule to actually lead into actually achieving this set objective. And I said, this is not just the work of the foundation or the healthcare professional or even the ministries or the policymakers. We all have a role to play in order to improve the survivorship of blood cancer in Nigeria for our people to survive these blood conditions. So collaboration amongst non-governmental organizations, amongst the hematology groups, amongst healthcare professionals, in addition to even the general practitioners, as well as the diagnostic centers, the imaging labs, and all stakeholders are actually needed to actually contribute their own quota to ensure that will actually improve a lot of our people, particularly in surviving this condition.